Kia ora, ka pai.
Am I putting her off standing here?
Yes, go.
Yeah.
Keep going.
Yeah, I know, right? Yeah, I stuck that.
Just say it like you're saying it to me, like kia ora.
I say it all the time.
Oh, yeah, I know.
All the time.
Yeah.
Kia ora to all those who are watching. Ko Tawira toku ingoa. My name is Tawira and I'm from Hapu Wānanga, Taranaki. You may have been directed here after attending Hapu Wānanga, learning about and revitalising the practices of our tūpuna. Or you may have made your own Muka Tie and want to know how to tie your new people's people. The reason why we tie or clamp the cord at birth is because there are blood vessels within. This delivers oxygen and nutrients to the baby during pregnancy. Because the cord is cut at birth, if the pito is not tied or clamped properly, the baby can bleed from the umbilical cord, causing baby to become very sick. Using muka or flax fibres to tie off the pito is an awesome way to connect back to our tūpuna instead of using the standard plastic clamp. Muka ties are also much more absorbent and hold antiseptic properties. This means that the stump dries up faster, is less likely to get infected, and can fall off from 3 days. That is compared to an average 10 days with a plastic clamp. Muka is also much more soft and gentle against baby's skin than the hard plastic clamp. Do not wash or sterilise your muka tie before using on baby, as this will take away the healing properties of the muka. Now that we've learned all about muka, we're going to dive into the tutorial. We are going to tie a total of 5 knots with one muka tie, and we will talk about the top and the bottom of the cord in relation to how we tie these knots. First, we select where the knot will actually sit on the baby's petal. The point is about 2 centimeters away from baby's belly button. And then we take our muka tie and tie just a normal standard knot, also known as an overhand knot. And then we're going to pull towards baby's puku so that you aren't tugging on the cord away from baby and causing damage to the cord. It's really important that this is a firm knot so it secures off those blood vessels. The second knot now, we are going to come around to the other side of the cord, or what we'll call the bottom of the cord. Again, doing a standard overhand knot on top of the ties and pulling towards baby. Nice and tight. Third knot now is back to the top. Again, a standard overhand knot. Nice and tight. For the fourth knot is the most tricky to explain but easy to do. In order to secure the knots and stop the tie from loosening or unraveling, we are going to lock the knot with an opposing knot, also known as a reef knot. So if you've been tying your normal overhand knot left over right, you would now, for the fourth knot, tie right over the left. Nice and tight. For the fifth and final knot, you're going to tie a normal overhand style on the top side of the cord. Nice and tight. For those with babies with a chunky or thick cord, we advise to do a second muka tie about 1 to 2 centimeters from your first muka tie to really seal that cord off, as a thick cord can bleed a little more. You can make several muka ties or just use a longer end of the muka tie as a second tie. So there you have it. Normal knot, top side, normal knot, bottom side, normal knot, top side, reef knot, top side, then normal once more on the top side. Ka pai, thank you for watching. Head on over to our Facebook, Instagram and YouTube channel for more information, and be sure to like, subscribe and comment. Aroha nui.